Hello, everyone. Let's start with a question. A 68-year-old man with severe atherosclerosis suddenly develops severe abdominal pain. Imaging confirms an occlusion of the superior mesenteric artery. Which part of the intestine is most vulnerable to ischemia? The best answer there will be splenic flexure. Let's see why. So today we'll be talking about regions of organs susceptible to ischemia. So most vulnerable zones in the body. We're going to start with the liver. So when you look at the liver hepatocyte, right? So in the liver, it has what we call hexagonal shape, right? So there's hexagonal shape. Around each of the hexagonal shape, we have our what? We have the portal triad. So we have the portal triad. And in each of these portal triad, we have the hepatic artery, the portal vein, and the common bile duct. So we have the hepatic artery, we have the portal vein, and then we have the common bile duct, right? And then when you look at each of these area, right? When you look at the liver, right, is divided into 3 zones. So we have zone 1, we have zone 2, we have zone 3. And in the center, we have what we call the central vein, right? So that's going to be the central vein. And then the blood that goes to the central vein, right? So the blood is going to move from zone 1 to zone 2 to zone 3. And then from the sinusoid, right, the blood will be dumped inside the central vein. And then from central vein, where are they going to go to? They're going to go into the hepatic vein, right? And then from hepatic vein, they're going to go where? Inside the inferior vena cava. And from inferior vena cava, they're going to go into where? The right side of the heart. So they're going to go to the heart, right? So if the blood flow from zone 1 to zone 2 to zone 3, so if you have a blockage of the hepatic artery, right? So that means there has to be decreased blood flow to the liver. And which area is far away from the hepatic artery? Very good, is zone 3. So that means zone 3 will be the zone in the liver that is more prone to ischemia. So zone 3, which is what we call centrilobular zone, right? Because it's around the central vein. And this is located around the central vein and has the lowest oxygen supply and is the most susceptible to what? Ischemia. Most susceptible to acetaminophen toxicity and also most prone to alcoholic hepatitis. Why? Because in the zone 3, that's where the acetaminophen and the alcohol will be, that's where they are mostly metabolized. And then once they are metabolized there's release of metabolic toxin. And those metabolic toxins are going to affect the zone 3. So that's why zone 3 is also more prone to acetaminophen toxicity and alcohol hepatitis. And just a side note, if this is supposed to be an ingested toxin, right? So if this is ingested toxin, for instance, let's say somebody who overdosed, who took a lot of cocaine, right? So if this is supposed to be ingested toxin, which area will be affected first? Very good, because when the toxin is coming in, the first area that it's going to get to, right, as it's coming in through the portal vein, is going to get to zone 1 first. So ingested toxin is going to affect zone 1 first, as opposed to metabolite toxin. So metabolite means that toxin means that they are produced as a result of what? As a result of metabolism, and that will affect zone 3 first, because that's where the most metabolism occurs, right? What about if somebody have right heart failure? So if somebody have right heart failure and the blood cannot go to the right side anymore, what's going to happen? Then the blood will back up into the IVC, right? So that's why in those patients they're going to have, because the blood back up to IVC and SVC. So inferior vena cava, superior vena cava. So they're going to have jugular venous distension. And that will lead to increased congestion of the hepatic vein. And that will lead to increase in congestion in central vein. So that's why those patients, they're going to have what? With right heart failure, they're going to have, very good, they're going to have centrilobular congestion. Very good. So they're going to have centrilobular congestion in those patients. So moving on, guys. So the next area, the next organ we're going to talk about is going to be kidney, right? And as you know, most of the blood supply to the kidney, they go to where? Very good. They go to the cortex, right? Just a small amount of blood goes to the medulla. And that's why the medulla is going to be more prone to what? more prone to ischemia. And so the outer medulla, especially the thick ascending limb of loop of Henle's. And then what pump is located there? Very good. So sodium, potassium, 2-chloride, right? And that's the pump that the furosemide is inhibiting. So that's located in that location. So the thick ascending limb of loop of Henle's and the straight sediments of the proximal tubules, those areas are going to be prone to what? Ischemia. Right? And renal papillae is also most susceptible to ischemia and NSAID. So if somebody is taking NSAID, example like ibuprofen, that could also affect those areas. Moving on to the next organ, which is the heart, right? And when you look at the shape of, when you look at the heart, right? So starting from outside, right? The outside covering will be the epicardium, right? And then followed by that, we have the what? We have the myocardium, right? And the inner part, which is lining the heart, right, is going to be our subendocardium, right? And then because when you look at the way the blood comes in, right, so the coronary artery is what supplies the heart, and the blood comes from outside, right? So if the blood is moving this way, so that means the area that will be fired from the blood supply is going to be the subendocardium, which is the innermost layer of the ventricle. And that's the area that will be most prone to what? Ischemia in the heart. And then who can remind us what EKG changes are you going to see with subendocardium ischemia? Very good. So you're going to see ST depression. So you're going to see ST depression on the EKG. As opposed to if a patient has a transmural infarction, whereby the whole wall is affected, that would cause ST elevation. So that will lead to ST elevation. I'm moving on to the next one, which is the colon. So in the colon, the watershed areas are more prone to ischemia. So watershed areas are regions of tissue located at the border zone between two artery supplies. And because of that, that makes them highly vulnerable to ischemia during systemic hypoperfusion. And what are these areas? So one, we have the splenic flexure, and then we have the rectosigmoid junction. Because at the splenic flexure, the last branch of the superior mesenteric artery and the first branch of the inferior mesenteric artery. So that junction between both of them, that's a watershed area, and that's at the splenic flexure. And that's more prone to ischemia. And that's what we saw in the first question that we did. The other area is the rectosigmoid junction. And that's the junction whereby you have the last branch, right, of the inferior mesenteric artery, right, which is the superior rectal artery, right? And then the middle and inferior rectal artery, right? So both of them, so the middle and the inferior rectal artery, those one come from where? They come from internal ilia. So that junction between both of them is also what? It's also a watershed area. And that will be prone to ischemia. And that's located in the rectosigmoid junction. And moving on to the last organ, which is the brain. So same thing in the brain, the watershed areas are also more prone to ischemia. And where is the watershed area in the brain? So the junction between the anterior cerebral artery and the middle cerebral artery, and the junction between the middle cerebral artery and the posterior cerebral artery. So those areas are more prone to ischemia because they are watershed zones. So injured during systemic hypotension or shock, and it causes watershed infarct, right? And the neurons in the brain. So what are the neurons in the brain that are more prone to ischemia? And these are high yield, guys. So certain neurons are highly susceptible to hypoxia, ischemia, because they have high metabolic demand and a low anaerobic capacity. So what are those neurons in the brain? The first one there, which is the most vulnerable to ischemia or hypoxia, is pyramidal neurons of the hippocampus. And that's going to be a broad question, guys. Most vulnerable neurons in the brain. And when you look at the clinical correlation, so those patients who have memory deficits after cardiac arrest, or they could have what? Hypoperfusion. The next one is Purkinje cells of the cerebellum, and that could lead to things like ataxia, dysmetria after ischemic injury. And the third one there is pyramidal neurons of the neocortex, and those are layers 3, 5, and 6 are most susceptible in those areas. And those patients could present with proximal limb weakness, right? Because it's affecting the junction between the anterior cerebral artery and the middle cerebral artery, which is one of the watershed area. And we've come to the end of today's lecture, guys. Let's do some questions. So the first question there is a 56-year-old hypertensive patient develops acute renal failure after prolonged hypotension. Which renal region is most susceptible to ischemia? So the best answer there based on what we said is going to be where? Very good. It's going to be straight portion of the proximal convoluted tubule, right? Next one, a patient who suffers from shock develops elevated cardiac enzyme. Which part of the heart is most likely to undergo ischemic injury first? So the best answer there would be the area that is far away from the blood supply, and that would be the subendocardium. Next question. A patient with ulcerative colitis undergoes colectomy. The pathologist notes mucosal damage in the rectosigmoid junction. Remember, that's one of the watershed area in the intestine, and is believed to be due to ischemia. This region corresponds to which watershed zone? So that's going to be the very good. So that's going to be the junction between the inferior mesenteric artery and the internal iliac, right? Remember, if it's supposed to be the splenic, so if it's supposed to be the splenic pressure, then that's going to be the junction between the superior mesenteric artery and the inferior mesenteric artery. And the last question, guys, a 55-year-old woman experiences cardiac arrest and successfully resuscitated after 10 minutes. MRI shows bilateral watershed infarct in the cortical and subcortical regions. Which type of neurons are most vulnerable to hypoxic ischemic injury in the brain? What do you guys think? Very good. Remember, we said it's going to be what? Pyramidal neurons of hippocampus. Thank you guys for watching. Please don't forget to subscribe, like, and share this video. And I will see you guys in the next lecture.